Few of us ever get the chance to save someone's life. As a potential kidney donor, you may have that once-in-a-lifetime opportunity.
When I found out that I was a match, this was the best news ever in the world, because now the whole problem was solved. It was perfect. It was the best thing that could have ever happened to me.
And then when my mom was a match, that was really, really great. And my sister was a match, so it was really great too. And I was absolutely ecstatic when my mom was a match and really wanted to do it.
Every day, more than a dozen people die waiting for an organ transplant. But today, kidney patients have renewed hope thanks to the selfless acts of some very special people.
It is such a marvelous gift that you can give to somebody. It changes the quality of someone's life. It changes the possibility of someone's life to give them a kidney.
I would say my life is different now because, I compare it to when I was on dialysis, because honestly now I really don't feel any different than before I knew I was in kidney failure.
Without a doubt, becoming a living kidney donor can be a rewarding experience, emotionally and spiritually. But for the person suffering from kidney disease, receiving a donated kidney is truly their best medical option.
There are a number of important differences between living donor and deceased donor transplantation. We expect much greater long-term successes from living donor kidneys. The living donor kidneys function better, and in addition to that, they also function longer. In fact, up to 50% longer than deceased donor kidneys.
Along with a higher success rate, people recover faster. And with this option, patients are off dialysis sooner or may avoid it altogether. But most importantly, a living kidney donation gets patients off a national wait list that's growing longer and longer every day.
People who are on the waiting list for deceased donor kidney transplant can expect to wait 5 to 7 years before they get their transplant. Someone who has a compatible living donor needs only wait 3 to 4 months until they get their transplant.
Another benefit is timing. Both donor and recipient can decide when they're ready to have the operation, allowing themselves time to prepare both physically and mentally.
I wanted it all to happen as quickly as possible. So, it was a great day, is what it was. We woke up, we all spent the night in a great little hotel down there that CPMC puts you up in Japantown, and we got ready. We were at the hospital early. We were so hopeful about what was going to happen and confident that everything was going to go well.
Living donors must be in excellent health. Often they're a close relative like a parent, child, brother, or sister. But a donor can also be a distant relative, spouse, close friend, or a coworker. And it's not uncommon for a kidney to be donated anonymously. In that case, it's called a non-direct or altruistic donation. Either way, the process usually starts with a conversation with a transplant coordinator.
The first step for any potential donor is to complete a screening questionnaire. During the questionnaire, we're looking at medical history, whether it be current or past. We ask questions about a history of cancer, whether that be for the patient or if it's in their family. We ask about the history of diabetes or high blood pressure or any kidney disease. If they answer yes to any of these questions, it does not automatically mean they will be ruled out, but we may request further medical information to determine if they're a candidate or not.
If there are no red flags, the next step is testing to see if there's a compatible match between donor and recipient. This is done with blood tests.
And that involves drawing blood to look at the blood type, which is one way we see if you're compatible, and we also look at markers on the blood called tissue typing to see if the donor is compatible with the recipient and make sure the recipient does not have any antibodies against the donor.
If the testing indicates that the donor and recipient are not compatible, they can still participate in our paired donation program to find a match.
The simplest explanation of paired donation is when you have just two pairs and you have pair A who are incompatible, pair B who are incompatible. The recipient from pair A can receive a kidney from the donor in pair B. The recipient in pair B can receive a kidney from the donor in pair A. That's the simplest match that can be done. That's just with 2 pairs. We can, however, match more pairs in the same way.
The way it worked out for us is they call a swap program. There was another family. There was a woman out in Washington who has a son here from San Francisco. Her son matched perfectly with my sister. I matched perfectly with his mom, and we were able to go ahead and do that for each other.
This program helped us out a lot. It was different, but I was really excited because I felt like there was another chance. My dad signed up for that also, and my husband signed up for it. And thank God, I had a long list of people that wanted to sign up for it, and it worked out with my brother.
If the potential donor is considered a good candidate, we'll schedule a full medical workup at California Pacific Medical Center. However, in some cases, these tests can take place elsewhere. The medical workup takes approximately 2 days, during which the donor will meet with a kidney specialist, also known as a nephrologist, a transplant surgeon, a social worker to make sure they are psychologically ready to donate, and a transplant coordinator to answer any remaining questions. After the team conducts a thorough review of the results, a CT scan is performed.
We use the CT scan to show us the anatomy of the kidneys so that we can plan the surgery safely and look for any unexpected findings like cysts or stones. And if possible, we like to choose the left kidney to donate because it has longer blood vessels, but sometimes we have to use the right kidney.
If there are no abnormalities, the last step is scheduling surgery. Donors are often concerned about the operation, but the procedure is considered very safe.
Whenever you have surgery and anesthesia, there's some risk, but the risk with the operation to remove a kidney is very low. All of our donors are very healthy. They've gone through a full workup showing that they're healthy, and we have a very experienced team, so the patients do well. Nationally, the risk of having a life-threatening problem with donating a kidney is 1 in 3,000. But there are more minor complications that can occur, like a minor wound infection, and the risk of that type of thing is about 2 to 4%.
Thanks to medical advances, almost all nephrectomies or kidney removals are done with minimally invasive laparoscopic surgery.
The operation to remove a donor's kidney is done laparoscopically because it leads to a quicker recovery and an easier experience for the donor. It involves placing 3 small incisions in the mid-abdomen through which we can place a small video camera and surgical instruments, and then a somewhat larger incision in the lower abdomen, just big enough to remove the kidney.
Typically, most donors spend 2 to 3 days recovering in the hospital before being discharged. Once home, they can resume their normal level of activities within 4 to 6 weeks.
Most people recover from living donor surgery quite quickly. People are generally on their feet immediately after the donation, leave the hospital after a couple of days, and are back to work within 6 weeks. People do limited work from home in the first couple of weeks and are exercising on a daily basis. We generally like to ask our patients to take it easy because sometimes they forget they've been through an important and large surgery. At about 6 weeks, most patients are back to full activity.
Recovery was basically easy. After 10 days or so, there wasn't that much pain. And then it was just recovering from the surgery and gaining back your strength, basically. I went back to work after about a month, and my daughter went back to work after about a month, and we were just back to normal, resumed the pace of our lives.
I have 2 small kids at home, so that was a little tough when I got home. I had to make sure that they stayed off of me, and I took it easy. About 4 weeks after, I was pretty much able to do anything I wanted to do. I still had to take it easy.
For the vast majority of donors, there are no long-term consequences to living with just 1 kidney.
Within a short period of time, the remaining kidney is functioning at 80 to 90% of the total of the 2 kidneys. An important study came out of the University of Minnesota a couple of years ago showing us how well living donors actually did long-term after their donation. In that study of over 3,000 patients, it was found that living donors did not have an increased risk of end-stage renal disease, high blood pressure, or any other disease for that matter, compared to people who did not donate a kidney. For this reason, we feel very comfortable offering living donation to healthy donors.
To tell you the truth, I forget that I did that a lot of times. sometimes my sister will talk to me about it and I'll remember, and I'm like, oh, I donated a kidney, that's right, because, I can't really even see the incision. So, I have a tendency to forget that sometimes.
I haven't noticed a single difference in anything having only one kidney. I haven't noticed anything.
Being a donor does not impact a woman's ability to have a child. For the most part, donors can do everything they did before, with the exception of participating in high-risk activities.
After you donate a kidney, your life is the same as before. You're on the same diet, you don't have to take any medications, your activities should be the same, your ability to work is the same.
There are really no restrictions for people who've donated a kidney once they've healed up. Some people are recommended not to participate in heavy contact sports like kickboxing or rugby, where direct blows to the abdomen are usual.
I can do anything I want to do. I ride a motorcycle at home. I play in a music band. I take care of my kids. I'm busy at school. There isn't anything that's changed because of the surgery.
As far as cost, donors do not have to pay for any medical bills related to transplant surgery. Those are picked up by the recipient's health insurance. But for some, there could be a few additional minor expenses. Even though the cost of the transplant is covered, donors need to consider extra expenses like travel, bridge tolls, lodging, and lost wages if sick time or short-term disability from work is not available. Normally, the donor's disability is authorized for 4 to 6 weeks. Donors need to ask their employer what type of application process is required to receive benefits. Once you know what is required, we can help you navigate the process. Not all workers qualify for disability, so donors should check with their employer. If any financial concerns stand between you and donation, please ask to speak to a social worker about our assistant programs that may work for you. Donors should never feel pressure to donate. Most donors feel positive about their decision, but if a donor feels extreme fear or pressure to donate, they should take more time to consider their donation. A follow-up appointment is scheduled 2 to 3 weeks after surgery. 6 months later, the donor is invited to the Living Donor Wellness Clinic, where they are examined by a nurse practitioner and are advised on how to best take care of themselves. The donors are encouraged to attend this clinic once a year. Donating a kidney may not work out for everyone. It takes a strong collaboration between the patient, donor, and their families to make it work. But for those lucky enough to give, this could be that once-in-a-lifetime opportunity to save a life.
Made me feel absolutely great. I see my sister now and she doesn't have to be hooked up to a machine anymore. That's a big deal.
It's such a different lifestyle with a kidney. I wouldn't even be able to put it into words. The life-changing experience that I've had with this, the difference in the quality of life that I have now.
I really tried to follow the kidney diet and, not do phosphorus and sodium and things like that, and now I really don't have to think about it.
It's probably, besides having my kids, the greatest thing I ever did in my life.